Greetings all. This is Miss Gibson. So we're going to do a quick overview of your renal medications. Once again, make sure that you're looking through your extra resources. I will make sure that I put some extra resources under the extra resource tab for the medications as well. So here are your objectives. So medications, you're going to have diuretics. Your diuretics are used to remove sodium and water from the body. It decreases edema. It also can be used for hypertension. And I want you to think about why why the doctor would give a diuretic for hypertension. Think about what extra fluid is going to do to the cardiac system. Make sure you know the different diuretics. You have your thiazide. This inhibits sodium and chloride reabsorption at the distal tubules. It can cause hypokalemia, hyponatremia, and hypercalcemia. It's used for edema related to renal failure, also for patients that have heart and liver failure. One example of your thiazide diuretics is your chlorothiazide. Next, we'll talk about loop diuretics, which is furosemide or Lasix. It promotes sodium and fluid excretion. It blocks reabsorption of sodium and chloride in the loop of Henle. If you notice, that is why it is very important that you know the anatomy. Your thiazide diuretics inhibit sodium and chloride reabsorption at the distal tubule. What does the distal tubule do? Loop diuretics blocks the reabsorption at the loop of Henle. What is the loop of Henle? Your loop diuretics, like your furosemide, can cause hypokalemia. Then you have potassium-sparing diuretics. One example would be your spirolactone. This inhibits potassium excretion and sodium reabsorption in the distal convoluted tubule. It is used in combination to decrease incidence of hypokalemia. So if their potassium starts to drop, they will add on spirolactone. Then you have an osmotic diuretic, which is mannitol is an example. It's used primarily in the treatment of increased intracranial pressure. If I have any emergency department or critical care junkies, that is, you'll see mannitol used in those areas. And then your carbonic anhydrase inhibitor, that is a mouthful. This promotes sodium and water excretion. It has little diuretic effect and not used often for renal failure. It is used to treat intraocular pressure in patients with glaucoma. I've not seen this carbonic anhydrase inhibitors used very often, but you will see it in practice. Let's see. So next we're going to talk about drugs for UTIs. You'll forgive me if I just took your hearing out. So sorry. Nitrofurantoin. This inhibits bacterial growth. It is a bacteriocide. It's used for many gram-positive as well as gram-negative bacteria. One is it will kill E. coli. It's used for most of your UTIs as well as cystitis or your bladder infections. Couple examples are microbid and microdantin. You do want to teach on the side effects, which is some GI disturbances, respiratory, chest pain. Some of your patients will complain of a cough. It may also turn the urine brown. So make sure that you let your patients know. Next, you have this methamine. So sorry, I cannot speak. This is for gram positive as well as gram negative. It will treat E. coli. It's used for chronic UTIs. I've not seen it ordered a whole lot, but it is used for the patients that get the kidney infections a lot and keep them. It can be used long term to prevent reoccurring UTIs. It is not used to treat an active infection. So they would give you another antibiotic and then add this one on. And then next, this, I'm not even going to attempt to say this, but this one here is your Bactrim. It's effective against most gram positive and gram negatives. It is effective for MRSA. You do want to provide teaching with your any of your sulfa drugs that they want to avoid exposure to sunlight. There will be some photosensitivity there. Your fluoroquinolones, this will, it's used for UTIs, STIs, eye infections, as well as lower respiratory infections. Some examples are Cipro and Levaquin. They can cause super infections, so make sure that you educate yourself on that. You want to warn your patients against driving or operating machinery. Do not take the fluoroquinolones with antacids, and you want to report any signs and symptoms of a super infection. So this is Pyridium, this phenazopyridine. I'm sure I'll just give you all a laugh. This is Pyridium. It just relieves symptoms of your urinary tract infection. It does change the color of the urine from reddish. It's a reddish orange color. It has no antibacterial effect. It only treats the symptoms. Make sure you know this drug. For incontinence, let's see, they sometimes will give estrogen to help increase blood flow as well as muscle tone around the vagina and urethral areas. It's used for stress incontinence in postmenopausal women. Your anticholinergics, this relaxes the smooth muscle and increases the bladder's capacity. So it's going to relax everything and kind of open the bladder to help with urge incontinence. It can have some serious side effects, such as it can worsen your glaucoma, constipation, and it can cause urinary retention. So we have to monitor for that and provide good patient education. Botox is something that is up and coming. It's injected during a cystoscopy or cystoscopic procedure into the bladder muscles to assist with muscle relaxation. It's very helpful in with urge incontinence. All right, so that's the end of this lecture. If you have any questions, please let me know. Once again, I'm going to continue to remind you guys, check your extra resources. They are there for you guys to help. We can only lecture for so long. I know that if my lectures are long, you guys will lose interest and you're not going to get anything out of it. So I do tend to be short and sweet to the point, but you are always welcome to email me. Thank you.